So today we'll be explaining DIBH, which is a part of the treatment planning for patients who are getting radiation for breast cancer. It is one of the ways that we use to protect the heart during radiation planning for breast cancer.
What it does is it moves the heart down as you take a breath, the diaphragm pulls it down, and the chest wall away. And that way it creates some space between the breast we're treating and the heart right behind it.
It is one of the most effective ways that we have to reduce radiation exposure to the heart.
Before treatment starts, you'll have a procedure called a simulation appointment, which may also be referred to as your mapping. These terms may be used interchangeably.
The purpose of the simulation is to set you up like you're going to have radiation treatment, but instead of treating you that day, we just make a scan that we use to create your radiation plan.
You've had CTs before, but this particular CT scan is to have you in a position that is reproducible each day for your treatments, so we can accurately and precisely treat you each day.
We'll ask you to lie on your back on a firm table with a mold under your head and shoulders that will be customized specifically for you. As part of the radiation planning session, as well as radiation treatment, we'll ask you to uncover your chest. We know this experience is unfamiliar and may feel awkward. We go to great lengths to ensure as respectful an experience as possible. Your arms will be supported above your head in the mold. This is the position you'll be treated in daily, so we want you to be as comfortable as the position allows. Please let the therapist know if something does not feel comfortable. They're happy to help you get into the best reproducible position. Try to relax your muscles, especially your shoulders. Once you're in the best position for your body, you'll be coached on the breath hold technique. We'll start with a little practice. You'll be guided to take a deep breath in through the nose and hold without arching your back. Our goal is for you to fill your lungs as opposed to taking a belly breath. We'll ask you to hold this breath for 30 seconds. Keep in mind to take in an amount of air that you could repeat multiple times without arching your back. After the 30 seconds, we'll instruct you to breathe out through your mouth. Keep holding still between breath holds to maintain your best position. We'll then ask you to repeat the breath hold for a shorter amount of time to check that you can take the same amount of air on each breath. Once you're comfortable with the breath hold, the therapist will start the process to scan you in the treatment position. They'll exit the room, but will continue to communicate to you through the intercom. They'll remain close and will be able to see and hear you. You should continue to breathe normally until you're instructed to hold your breath by the therapist. The therapist will say, "When you're ready, take a deep breath in through your nose and hold." Remember, this appointment is about you. Please take your time and try not to feel rushed. The experienced therapist will be able to see when you have started your breath hold. Once you're in the breath hold, the CT scan will begin and only takes 10 to 15 seconds. The therapists communicate via the intercom as soon as you can breathe out through your mouth. Please remember to keep holding still between breath holds. If at any time you can't hold your breath, let it out and breathe normally. Once the CT scan is completed, the therapist will finish the simulation procedure and give you a few tattoos the size of small freckles. These are placed with a thin needle just below the skin surface. These are necessary for your treatment, as the therapist will use them to get you into the same position each day. Before you leave the radiation oncology clinic, you'll receive an appointment card with the date and time of your first treatment. You'll receive the full schedule when you come for treatment on your first day.
So after you complete your simulation or mapping appointment, the medical dosimetry and physics team will take over to create a treatment plan that best treats your cancer while also protecting normal surrounding tissues.
Now that we have your radiation treatment plan in hand, it's time to begin your treatment. After arriving for your appointment and putting on your gown, the therapist will bring you into the treatment room and provide instructions on how to lay down on the table in the same position and mold we made for you during your simulation appointment. You'll be asked to lower your gown so that the therapists can see the tattoo marks on your skin. The therapist will turn on a software system called Vision RT, which will project a bright red light onto your skin. There is no radiation with the Vision RT red light system, and it is safe to look at. This system is used to fine-tune your position by tracking your skin surface. Vision RT is a very important part of your setup and helps the therapist to know when your breath hold is in range for treatment. Once you're properly aligned, the therapist will coach you into your breath hold. You'll be asked to take a deep breath in through your nose and hold. While you're holding your breath, the therapist may adjust the table to fine-tune your position. A small monitor will be moved into your field of view. It displays 2 bars, one thin and one thicker of varying colors. Your breath is represented by the thin colored bar. You can practice taking a deep breath in through your nose and watch the thin colored bar rise into the thicker bar. Ideally, you want to move the thin colored bar into the center of the thicker bar on the dotted line. It's important to take a deep breath in through your nose and not arch your back. This helps to expand your chest for treatment. As a reminder, our goal is to fill your lungs as opposed to taking a belly breath. Once your breath hold is in range, the therapist will tell you to breathe. Remember that the colors on the bar can change, and that's okay. Before stepping out of the room, the therapist will prepare to take setup images, which may be an X-ray or a low-dose scan. This is standard practice for your first appointment to verify your internal positioning is the same as your simulation day. Once the therapists are outside of the room, they'll make sure that you can hear them on the intercom. They'll ask you to take a deep breath in through your nose and hold. The machine will turn on and you'll hear a beeping sound during the radiation beam. The therapist will instruct you when to breathe, but you can breathe at any time if needed. Just breathe and the machine will pause. The therapist will pick up where treatment left off when you're ready to hold your breath again. Once your position is verified on the X-rays, the therapist will start the treatment. Remember that the therapist will talk to you throughout the treatment, so please speak up if you need anything. Once the treatment is complete, the therapist will instruct you to breathe and bring your arms down. The red lights will turn off.
So hopefully now you know what to expect, but if you do think of any questions, either later on or, before anything starts, let us know. You can call us at any time, and you can ask for your doctor, you can ask for the nurse, or you can speak to the front desk. If you'd rather write us a message, feel free to use MyChart messaging to reach out to us.
This video was made possible through a grant from the Victoria Buffum Fund.